So that is why when parents they come to us, just today there were parents when they came to me, I was astonished to see that someone has prescribed their children with Brahmivati. For autism, they were taking Brahmivati. They were taking Makar Dhwaj, which is a metallic preparation, and one of them was being given with Jyotishmati while the child was already hyperactive. So that's why it becomes very important that although we say Ayurveda is safe, but for Ayurveda to work, someone who is guiding you for your children needs to be educated enough, needs to have thorough knowledge of which herb to be used for which part of the behavior and at which age. So if a child comes and if a child is not verbal after the age of 4.5 years, we are to avoid brain tonics and the direct brain tonics for the child, because that will further make the child hyperactive. So that's why over there when we give treatment to the child, ABA becomes all the more important over there. When I talk about ABA and herbs, many a times the parents they ask me that if you are using the right kind of herbs, why do you need us to do ABA? Why not just the herbs? So that is what I always guide the parents who come to me after 4.5 years of age, that please do remember that after 4.5 years, the language is to develop through training. It's only through training that language will develop after 4.5 years. So especially for those of you who come to us at a higher age group of their children, it becomes very important that on one hand where we are increasing the focus, the positivity, the concentration span, the right and left brain coordination for your child. On the other hand, we are doing the right kind of ABA for your child. Now, what is this right kind of ABA for your child? Let me come to ABA. And before I come to ABA, I need to be telling you something about OT. When I talk about OT, OT is primarily a command based therapy. So, when we are doing OT for anyone, if you see anyone doing OT for your child, what they will generally be telling your child, which is the green out of these, put rectangle on rectangle. They will give various commands to your child and the child will then be following those commands. And if I talk about ABA now ABA is entirely a different therapy. And again when we go in ABA, generally ABA can be of two types. One is the command based ABA, another one is the non-command based ABA. A very delicate balance has to be maintained between command based ABA and non-command based ABA. In most of the cases when I come across children who have been getting ABA done from therapy centers, unluckily the child is given a tab in his or her hand. Through the tab the child is made to communicate with the parents and the parents are told the right first day. Now this is the biggest hindrance I see in a child developing language. The parents are again and again told by those therapy centers, by any psychiatrist, by neurologist, by pediatricians that see, if a child is autistic, he is never going to come out of autism. Now that is the biggest thing which is in the brain of the parents. And when the parents they travel across borders, they come to me. When I go to various countries, when the parents meet me, that is the first big question which they have in their mind. They always ask me, sir, you are saying it can be done, but we always have seen that it cannot be done. We have been trying this and this, and when I come across the things they have been doing, I'm really disappointed, because I know about Ayurveda, I cannot comment about homeopathy or something, but when I see what they are using, they are never using the age appropriate herbs, the behavior appropriate herbs. They are simply taking a combination of so many herbs mixed together for the children. Now that is a very big problem for them. So that is why it becomes so very important that we choose the right kind of herbs for our child. Again, when I say choose herbs for your child, it's not very easy for any child. to consume herbs. Specifically, if a child is autistic, if a child is ADHD child, if a child is GDD child, do you feel it is easy for anyone to be giving herbs to that child? No, it's not. And that is why it took us so many years and years of research, of product development, where we made too many things, where we had too many things done. We worked a lot on the herbs in the processing, and finally we developed things which are really very tasty for the child.
Autism is a temporary phase in the life of a child if treated timely.
A patient name, Moksh, patient age, 6 years old, disease, autism. A chief complaints, hyperactivity, aggressive behavior, speech delay, deficit eye contact, lack of attention. A history of patient. Moksh's parents consulted Dr. Navdeep Sharma for his autism treatment. They discussed about the chief complaints. They started the treatment after being convinced for the same. Interacting with Moksh was challenging as he had difficulty understanding and rarely engaged with those around him. Moksh struggled with speech delay and often seemed lost in his own world. His hyperactivity and irritative behavior made it hard for him to connect with others. After treatment from ND Care by Dr. Navdeep Sharma, Moksh has started using words to express himself, and his speech has improved significantly. Moksh is now much calmer and more focused. The hyperactivity that once overwhelmed him has reduced, and he's more at ease. We're seeing a new side of him. He's interacting more, engaging with those around him, and forming meaningful connections. His understanding has grown remarkably. He responds better, and everyday moments now feel filled with progress and joy.
Hello, my name is Pooja. My son's name is Moksh. My son is 6 years old now. When he was 3 years old, he was diagnosed with autism. When we consulted the doctor, they said that there is neither any medicine nor any cure for this. So we were very worried. My child was very hyperactive. He had no concentration, no attention, and he lacked eye contact and toilet training. We were constantly worried. Then we learned about Dr. Navdeep Sharma, so I contacted him. We started my child's treatment in November 2022, and gradually my child began to show a lot of improvement. My child's understanding improved, his eye contact increased, and now it's been almost 2 years. My child has almost recovered. Thank you so much, Dr. Navdeep Sharma. Thank you so much. You have almost cured my child. We had lost hope that my child would ever get better. Thank you so much, and above all, I want to thank Tina Mom, who is our coordinator. Mom has always motivated me. Thank you so much, Ma'am, and Rahul sir, who have always guided me on how to handle the child, how to do activities with him, and how to deal with the child. Sir explained to me, and because of that, my child's sitting time has increased and his concentration has improved. Now his hyperactivity has also reduced. My child now recognizes everyone. Earlier, my child used to go to a special school. Now he is studying in a regular school, and I am very happy. Thank you so much, sir. Thank you so much. Thank you so much, Tina Mom. Thank you to the whole team of ND Care.
Call now to connect with World's Senior Most